In the last video, we completed tetracyclines. They are broad-spectrum antibiotics. Their classification as short-acting, intermediate-acting, and long-acting. Their mechanism of action involves the bind to the 30th ribosomal subunit, thereby preventing the synthesis of the protein. Now in this video, we will discuss regarding AMPHENICOls. They are broad-spectrum antibiotics which include chloramphenicol, thiamphenicol, and fluorophenicols. Now let us come to chloramphenicals. They are obtained from Streptomyces venezuela in the year of 1947. They are the first antibiotic to be chemically synthesized. They are the derivative of dichloroacetic acid which contain nitrobenzene unit, and they are natural white or grey yellow crystalline powder. They are broad spectrum, active against gram-positive, gram-negative and rickettsial, chlamydial and also mycoplasma organisms. When it comes to the mechanism of action of these chloramphenicals, they act by binding to 50th ribosomal subunit. But when it compared to the tetracyclines, they act by binding to 30th ribosomal subunit. By binding to 50th ribosomal subunit, they interfere with the bacterial peptidyl transferase activity. They inhibit peptidyl transferase enzyme, thereby resulting the inhibition of microbial protein synthesis. It is due to interference with the transfer of elongated peptide chain to the newly attached amino acyl tRNA at the mRNA ribosomal complex. Bacteria can develop resistance against these chloramphenicals by synthesizing the chloramphenicol acetyltransferase enzyme. Examples for these chloramphenicol include chloramphenicol palmitate, which is administered orally in monogastric animals, but in case of ruminants, oral administration is not recommended because the chloramphenicol is inactivated by the ruminal microflora in case of ruminants. And the other drug, that is chloramphenicol sodium succinate, which is administered as IM route or IV. And these chloramphenicals are metabolized by the mechanism of glucuronic acid conjugation in the liver, and these are the potent microsomal enzyme inhibitor. Thereby this decreases the metabolism of other drugs such as phenytoin and barbiturates. Now let us come to the toxicity of these chloramphenicals. Chloramphenicol contain paranitro group in their structure, which is responsible to the irreversible suppression of the bone marrow, which ultimately leads to the aplastic anemia. And the other toxicity which is noticed in the neonates is the gray baby syndrome, which is characterized by vomiting, flaccidity and cyanosis, which is followed by the cardiovascular collapse and eventually leads to the death. And these chloramphenicals are drug of choice for treating Salmonella typhi infection. Now let us come to thiamphenicals. They are semi-synthetic derivative of chloramphenicals in which paranitro group is replaced by sulfamethoxic group. Therefore, these thiamphenicals are less toxic as compared to the chloramphenicals. In the structure of chloramphenicals, there is the paranitro group, which is responsible to the irreversible suppression of bone marrow, which ultimately leads to the aplastic anemia. Now let us come to florfenicals. These are fluorinated derivative of thiamphenicals. Thiamphenicals are the semi-synthetic derivative of chloramphenicals, and they are less toxic as compared to the thiamphenicals. Therefore, by using fluorofenicals, there is the less chance of irreversible bone marrow depression, and it is recommended in cattle for treating respiratory diseases. This is about Amphenicols, which include chloramphenicol, thiamphenicals, and florfenicol. They are broad spectrum antibiotics